Good morning all. Today we are going to see about newborn assessment. First I wish to say what is meant by newborn. A healthy newborn infant born at term between 38 and 42 weeks cries immediately after birth, establish independent rhythmic respiration, quickly adapt with the extrauterine environment. Their average weight is 2500 grams. So the baby's birth weight is 2.5 kilograms to 3 kgs. So here newborn examination, first I wish to say what is meant by newborn examination. It's a systematic examination in both physical and neurological examination of the newborn. Newborn means which the baby after the delivery 1 to 28 days. Babies are called newborn. Here we are doing the system examination. It will help to assess the physical and the neurological abnormalities and then any deviation. When we are doing the proper examination, it comes to know whether it is they having any physical or neurological abnormality. Object is to know infant state of development and well-being, to detect any deviation from normal, to assess the progress of the child. These are the objectives in the newborn assessment. First, when we are doing the examination, it comes to know whether the baby is healthy or wealthy. And an indication, we are doing 3 types of examination. First examination, we are held in the labor room within 2 hours of birth, and second examination before the discharge, and then third examination we were held on the 6th to 8 weeks. Totally we are examined the baby in 3 times. The entire newborn examination will be on 3 times. So next articles. First we have to arrange the temperature, which means temperature, vital signs tray, and then stethoscope, measuring tape, torch, heart and vibes, machine, weighing machine, Macintosh, kidney tray, paper bag, bowl and cotton. These are the equipments we have to keep near the baby's head, which help to do the baby's newborn examinations. Initial assessment, we have to identification. In identification, check and identify the sex of the infant and record with the name, sex and their register number. So here we know the identification. We have to confirm with the baby name, and then we have to confirm with the sex and then register number. Identify their gestational age, whether the baby is having the full term and preterm and postpartum. These are the identification we have to do the initial assessment. And the next, vital signs we have to monitor. In vital signs, we have to check the respiration. The baby's normal respiration is 40 to 60 beats per minute, and then heart rate 120 to 140 beats per minute, and temperature 36.5 to 37.5 degrees Celsius. So we have to assess the vital signs. It will help to know the normal functions of the body. And the next thing, we have to do the physical examination. In physical examination, we have to start with the checking the height. So here we have to check the baby's length. Here baby's normal length 47 to 50 centimeter. So we are assessing crown to heel length with the baby's supine position, with the knee slightly pressed down to get maximum leg extension. And the next, we are assessing the head circumference. Normal head circumference is 33 to 35 centimeter. It is measured with a measuring tape. It's across the center of the forehead, and most prominent first of the posterior head should be included into the head circumference. So normal head circumference is 33 to 35 centimeter. And the next is chest circumference. So chest circumference is normal is 30 to 33 centimeter. Here we are using the tape. We have to start measure with the level of nipple and about 2 centimeter level of the nipple, and then it will be about less than 2 centimeter in the head circumference. And next, we are assessing the weighing. So weight is approximately about 2.5 to 3.5 kgs baby's weight, if it is considered normal. So next one, the posture. So here supine position with the partial flexion of arms and the legs and hands, commonly turned little to one side. Hip joints are partially abducted. So here the babies partially flex their arms and legs, and the next the hip will be partially abducted. It's a normal position. And the next, we move on the skin. Here the skin, most newborn have ruddy complexion thus due to the increased concentration of the RBC. The babies look like a pinkish and red color. It's because of the increased concentration of RBC and a decreased amount of subcutaneous phage. This redness will be fade within 1 or 2 months. And next we have in addition we have to see some other colors also, so which is the cyanosis. So cyanosis, I think people know, that is the bluish discoloration of the skin. So commonly there is two types of cyanosis are there. One is the peripheral cyanosis, another one is the central cyanosis. So peripheral cyanosis appear due to the immature peripheral circulation. This is normal within first 24 to 48 hours after the delivery. There is a due to the peripheral circulation alteration, it's caused the peripheral cyanosis, which will be disappear within 24 to 48 days or 48 hours. And then next one is the central cyanosis. It indicates decreased oxygen may cause due to the respiratory distress and then other diseases. So if the baby is having any respiratory distress or asphyxia, it may cause the respiratory central cyanosis. Next we move on the in skin. So in skin this is a soft white cheesy yellowish cream on the infant skin at birth. It is caused by the secretion of the sebaceous gland of the skin. It offers protection of the babies from watery environment of the uterus. It is absorb the skin after birth and serve the natural moisturizer of the baby. So here the baby is having the wernicke gaseosa. It's like a cheesy yellowish substance that is around the babies. So it helps to protect the baby when they are in the womb, mother's womb. And next we move on the lanuco. This is the long soft growth of fine hair on the infant's shoulder, back and forehead. It is disappear early in postnatal life. Desquamation, which means peeling of skin take place few days after birth and most mark on the hands and the feet. So desquamation is the baby's skin peeling, which occur after within few days. It may occur especially in the hands and feet. And next we move on the milia. These are the teeny sebaceous retention cysts. They appear in small white or yellow dots and common in the nose, forehead and cheeks of the infant. They are pinhead size and then opalescent. This is in the picture itself it's no, that is the milia. And next erythema toxicum. It's begin as papule, increasing in severity to become erythema. Erythema means nothing, it's a red color discoloration over the skin. In the picture it's show. By the second day it then disappearing by fourth day onwards. So it will be it's a normal only. This is color deviations. And the next one is the Mongolian spot. Mongolian spot, there is a bluish black coloration in the infant lower back, buttocks and then anterior trunk. These spots are not bluish, they are not associated with the mental retardation. It's normal when kids. So it will be disappear with their early childhood. It's called the Mongolian spot. So next we are assessing the baby's head. Newborn head appears disproportionately large because it's 1/4 of the total length. So next fontanelle, there's a two types of fontanelles are there. One is the anterior fontanelles and then posterior fontanelle. So here anterior fontanelles is the diamond shape and then it's normally closed 9 to 18 months, and the posterior fontanelles is the triangular in 4. It will be closed in 1 to 1.5 months. So here the first we can see in the anterior fontanelle, and then in back side we can see in the posterior fontanelles. That's the status. Next we move on the caput succedatum. It is the edematous swelling on the baby's scalp due to the infiltration of the serous fluid by the pressure. It is disappear in few days. So and next is cephalocomatoma. That is cephalocomatoma is the blood accumulation. Caput succedatum is the fluid accumulation. So here in cephalocomatoma, it is collection of fluid in the between the periosteum and then flat bone of the skull. It will also normally it may disappear within few days. And next eyes. When newborn cries, tears may not be seen. Lacrimal duct are not fully mature until 3 months. So as we know, the babies they are crying loudly, but the tear is not yet come. So because of why the immature of the lacrimal duct, and then eye should appear clear without any redness or purulent discharge. The retina look like very clear. There is no purulent or there is no redness. If there is any redness, we have to consult the doctors. And ears, the infant's ears tend to be folder and creased. A line drawn through the inner and then outer candle of the eyes should come to top of the nodes. The eye it's joined the scalp. The infant usually responds to the sound at birth. So here we are drawing first picture shows the normal and then slightly deviations in the eyes, and then another one is the low set of the ears. So low set of ears show the babies having any chromosomal abnormalities, babies having low set of ears. So next we move on the mouth. The infant lips should be pink and tongue smooth and symmetrical. Mouth should be absorbed of cleft lip and cleft palate and a tongue tie. So in mouth abnormalities, they have the abnormalities in the cleft lip and congenital abnormality, which is the cleft lip and the cleft palate. So those are having the tongue tie, the baby is having the delay speech. So when we are identify it's an early soon, we can treat them and their development will also become normal. Occasionally, small round cluster cyst, which is the Epstein pearls, may present in the palate due to the extra calcium deposited in the uterus stem. So it will be disappear in their early life. So next, neck. The neck of the newborn is short, often chubby, creased and skin fold. The head should be rotate freely on it, and chest look small because the infant head is large in proportion. Comparing the chest in early life, the head will be the big one, and then once they enter their infant period, the head will become small and then chest become big. Possible breast encouragement with the secretion of the thin watery fluid, which is the bitch milk, due to the mother hormonal secretions that may cause the bitch milk. It will be disappear in few days. And next, abdomen. Bowel sound will be present. Edge of the liver is palpable within 1 to 22 centimeter below the right costal margin. And stomach, the capacity of the infant stomach is about 30 to 60 centimeter at birth, but it will be increasing rapidly. Further days it will be increased. First, in newborn their capacity is only about 30 to 60 centimeter at birth. And next, umbilical cord. When we are examining the umbilical, it has 2 arteries and 1 vein. After the clamping, it begins to dry and then falls after 6 to 10 days after their delivery. So here we have to provide the umbilical cord, umbilical care. And the next, back. And the spine of the newborn typically appears flat in lumbar and the sacral areas. Here the baby's genital anus must be inspected for the patent and not covered by the membrane. In male babies, both testes are present in scrotum. We have to examine whether the urethral opening or epispadiasis or hypospadiasis are present or not. And in female babies, we have to check whether the labia majora is fully covered with the labia minora. These are the things we have, whether the urethral opening is present or not. These are the things we have to examine when we are examining the genital of the newborns. And next we are move on the extremities. In extremities we have to examine, observe the syntactily and then polydactyly. A full term baby have crease covering their entire sole. So in polydactyly, the babies, when we are checking the digits, extra digits of fingers or toes having, that is known as the polydactyly. And syntactily means fused digits. That these are the things we have to examine the extremities. And next we are more on the neonatal reflexes. So there is a multiple type of neonatal reflexes are there. When we are examine the baby, we have to examine reflexes help to assess the muscle tone, head control, and these are the essential aspect we can assess through the reflexes. There's the 2 types of reflexes are there. One is the protective reflex and then another one is the primitive reflex. So in protective reflex, it's blinking, coughing and sneezing and gagging reflexes are These are the protective reflex. In primitive reflex, rooting, suckling, moro, startle, tonic, stepping, and palmar reflex are the primitive reflex. And blinking reflex, this infant blinks at sudden appearance of the light. And next one is the pupillary reflex. Pupil constrict when we are applying the bright light signs towards it. The babies having they constrict their pupil, which means that is the pupillary reflex. In doll's eye reflex, as head moves slightly to left or right, eye lag behind and down, not immediately. Adjust to see the position of the head. Disappear the fixation develop. Here the doll's eye reflex. Turn the neonate head slowly to the right or left side. Then normally the eyes do not move. There is the fixation will be there. And next one is the sneezing reflex. It's otherwise called as the glabella reflex. Tapping briskly on the glabella cause the eyes to close tightly, disappear as the brain matures. So that is called the sneezing reflex. The foreign substance entering the upper lower extremities, lower airways, they need to clear their airway passage. So there the sneezing or coughing will be there. That is the sneezing. And the suckling reflex. So here the sucking, touching the lips with the nipple of the breast, the baby start to suckling movement. Not suckling movements will take their food inside. It will be diminished within the 6 months of life. Rooting helps the baby become ready to suck. When the root of the baby's mouth is touched, the babies will begin to suck. That is the once when we touch the nipple, the baby start to suck. So that is the suckling reflex. So next move on the rooting reflex. The infant stand his head and open his mouth to the side. When the side of the face is touched, so that is the touching or stroking the baby's cheek near the corner of the mouth. So the baby's head turns towards the stimulation. Mainly when they find out their food, it will be disappear within the 7 to 8 months of their week. And next one is the gag reflex. So here gagging, stimulation of the posterior pharynx by food, suction or passage of the tube causes infants to gag. When more food is taken into the mouth, that the babies they can't be successfully swallowed, immediately return to the so here if the food is not digested, the food will be undigested food will be returned back. That is the gag reflex. So it's a passage of the food digestion. So that is gag reflex. So next we move on the Moro reflex. So here the Moro reflex, startling the neonate with a loud voice or apparent loss of support due to the change in the equilibrium. The neonate is held in supine position, supporting with their upper back and a head with one hand, with the lower back with other. The newborn head is suddenly allowed to drop down back for an inch. So this is generally when we are giving the tap, which one side due to the muscular activity, there is a symmetrical abduction and extension of the arms and legs with the fanning of fingers. The thumb and index fingers become C-shaped on both hands. These asymmetries then flex. The baby may cry due to when we are giving the sudden drooping or sudden sound when we are making the sound. This will be there. So Moro reflex will be disappear within 3 to 4 months of life. So next one is the tonic neck reflex. So here the tonic neck reflex, it is elicited by rotating the infant head from the midline to one side. The baby should respond by extending the arm on the other side, to which the head is turned and flexing the opposite arm. The arm extremities respond similarly. This tonic neck reflex will be here the picture is show, the head and the arms will be in the one side, extending one side, the other side will be flexion will be there. So that is disappearance 2 to 4 months. Next one is the palmar grasp reflex. Here elicited by the examiner's placing her finger on the palmar surface, the infant hand and baby will be grasp the finger. So when the object in the neonate palm, they start to grasping the object and then they close their fingers. So it will be disappear within the 6 to 3 months of their life. That is the palmar grasp reflex. So next one is the extrusion reflex. When tongue is touch and depress the baby's response by forcing it outward, disappear by will be exclusion. If when we are touching their baby's tongue, they extrude their tongue in outward, that is the extrusion reflex. It will be disappear in 4 to 5 months of the age. So this is about the extrusion reflex. And the next one is the yawning, spontaneous response to decrease oxygen by increasing the amount of the inspire. So this is yawning when we are feel sleep, or when we are feel that there is a like decreased amount of oxygen in our blood, they need to increase the inspiration air. So there is a and next we move on the sneezing or coughing reflex. So here foreign substance enter in the upper and lower airways, clearing the upper passage of sneezing, and the lower air passage is causing passage. This is not appear at any age. So when they enter, when they in airway, if there is any foreign substance enter in our airway, it will be clearing the object. So here yet now we discuss about the reflex and then head food assessment of the baby. So here I wish to say what are the danger signs in the newborn. First one is the poor feeding, suckling and then swallowing reflexes. So if the baby is having any poor feeding, there is an alteration, there is suckling and the swallowing reflex, which indicate the baby is having any abnormal in their development. And the next, cold to touch or having a rise in their body temperature, poor activity and then poor response to the stimulation, excessive. If the baby is having the excessive crying and then irritability, a rapid respiration more than 60 per minute, and then presence of the chest retraction, blue discoloration of the lip or tongue, drooling of saliva or choking during the feeding, and labor respirations are all absence of respiration. Jaundice appears within 24 hours or extending to palms or soles. No urine within 48 hours and no methane within the first 24 hours. So and then convulsion and abnormal movements, bleeding from any site, umbilical disc or superficial infections like pyoderma, any abscess or diarrhea, vomiting and then any abdominal distension. These are the abnormal or danger signs in the newborn. So here we have to immediately consult with the physician. So I think people are understand about the normal newborn assessment. So in next class we will see in abnormal newborn assessment. Thank you for watching.